Ever feel like your brain is moving in 100 directions at once? You start a task, get distracted, start another, and by the end of the day, nothing's done? We've all been there, but for people with ADH, this can be a daily challenge. Today, we're talking about ADHD, or Attention Deficit Hyperactivity Disorder. We'll break down the signs and symptoms, how it's diagnosed, and what treatment options are available. Let's dive in. ADHD, understanding the signs and seeking help. 1. What is ADHD? ADHD is a neurodevelopmental disorder that affects how the brain regulates attention, impulse control, and activity levels. While it's often associated with children, ADHD also affects adults, many of whom were never diagnosed as kids. There are three main types of ADHD. Inattentive type, trouble focusing, staying organized, and finishing tasks. Hyperactive impulsive type, fidgeting, talking nonstop, acting without thinking. Combined type, a mix of both inattentive and hyperactive impulsive symptoms. It's important to remember, ADHD isn't about laziness or lack of willpower. It's about how the brain works differently. Recognizing the signs. The signs of ADHD can vary, but here are some common ones to watch for. In children, trouble focusing on tasks or instructions, frequent daydreaming, forgetting or losing things often, fidgeting or inability to sit still, acting impulsively or blurting out answers. In adults, difficulty managing time and staying organized, starting projects but rarely finishing them, restlessness or feeling constantly on edge, interrupting others or talking excessively, struggling to focus, especially on boring or repetitive tasks. If these symptoms are interfering with school, work, or relationships, it might be time to get evaluated. 3. Diagnosis and assessment. ADHD is typically diagnosed through a combination of interviews, questionnaires, and behavioral assessments. There's no single test for ADHD. A healthcare provider, usually a psychologist, psychiatrist, or neurologist,